So how is it in your hometown? Do you take biopsies? Because you need to do this in all patients that have chronic diarrhea, because then you give the pathologist the ability to make a diagnosis. And as you know, there are 3 subtypes. It's the collagenous colitis, it's the lymphocytic colitis, and it's a new concept we call the incomplete microscopic colitis. These are patients that have chronic diarrhea, but they're not normal histologically, but they don't fulfill the classical criteria. But what they all have in common is that they have increased lymphoplasmatic infiltration in lamina propria. And this is throughout the whole colon. It's a pancolitis. But then the pathologist should measure the collagenous band. And if it's thicker than 10 micrometers, then it's a collagenous colitis. You have to count the intraepithelial lymphocytes. If it's more than 20 per 100 intraepithelial lymphocytes, then it's a lymphocytic colitis. So, and the incomplete would be not normal and not up to these criteria, somewhere in between. And right now, these patients don't get a diagnosis. So we want to know if they would even respond to budesonide, as we know they do in the other subtypes.